It's safe to say fractures are emerging in the Make America Great Again movement.
Cast aside by the president and the MAGA political machine.
And some Republicans see its health-focused Make America Healthy Again counterpart as having the potential to be the party's next big thing going into the midterm elections.
It's been a critical part of our success in Washington.
That was at a MAHA summit in November. It underscores just how closely Republicans have hitched themselves to the MAHA campaign, banking on its popularity to give them an electoral bounce. But the strategy carries risks. Health and Human Services Secretary Robert F. Kennedy Jr., a longtime anti-vaccine activist who rails against Big Pharma and ultraprocessed food, is the leader of the movement, and American support for Kennedy is cratering. Plus, polls show voters care more about reducing healthcare costs than MAHA priorities such as ending vaccine mandates and promoting raw milk. Enhanced Affordable Care Act subsidies expired at the end of 2025, fueling a nationwide affordability debate. Roughly 24 million people buy coverage on the Affordable Care Act marketplaces, and many are now facing premium payments more than double what they paid last year. MAHA became mainstream as part of Kennedy's political platform when he ran for president in 2023 and 2024. When he suspended his campaign and endorsed Trump, Kennedy united MAHA with conservatives, marrying the health freedom movement with MAGA. But the movement took root before then, during the COVID pandemic, with many supporters opposing vaccines. It's grounded in the idea that the U.S. is in the throes of a chronic disease epidemic, fueled by corruption in the food, medical, and pharmaceutical industries and federal agencies. MAHA's gained significant clout in a short period of time. Kennedy recently announced new dietary guidelines and updated childhood vaccine recommendations, which were both part of the movement's wish list and departures from existing frameworks. The House and Senate now have a MAHA caucus, and lawmakers in Republican-led states are introducing or passing legislation to advance the MAHA agenda, including laws to restrict mRNA vaccines and ban certain additives in food. Food manufacturers, including Nestle, General Mills, and Kraft Heinz, have pledged to remove artificial dyes or additives, and MAHA supporters include desirable voting demographics, independents and some Democrats, many of whom are women, younger voters, or suburbanites. About 21% of independent voters and 8% of Democratic voters held a favorable or somewhat favorable view of MAHA as of early fall, but voters are far less enthusiastic about Kennedy and his denouncements of vaccines and efforts to limit access to them. And this is where Democrats see an opening. After taking a political backseat in recent years, healthcare may dominate the 2026 election races. Follow us for more.